Hi everyone, my name is Cecil Jane Mangiran, together with my colleague
Love de la Victoria.
and for today's return demonstration, we will be church nurse.
Good morning, nurses. Today, our patient has, we have patient number 1. He's having a stroke. He has a history of diabetes, and then he stopped smoking 3 years ago. So this patient has a rest for injury. So we have to, pay attention for this because he has a rest for fall. She's gonna discuss about our patient number 2.
Good morning nurses, and for the patient number 2, he has fracture in spine. He is 19 years old and he is drowsy and his skin is cold to touch. Also, he is pale and he has low blood pressure, and this patient is risk for a fall.
Hi, I'm student nurse Vincent A. Umongos.
And I am also Danilo B. Sulaiman Jr. and we are
the medication nurse. These are the medication of patient number 1. So first, ang labetalol, 10 mg. Ang ikadua kay nicardipine, 5 mg.
Okay.
Ikatula ang labetalol, 10 mg gyapon.
Okay.
Kapat ang Altiplace.
Okay.
So, mao na siya atong ihatag sa atong patient number 1.
Okay, for the patient to, these are the medication. Stat methylprednisolone, and then naproxen 400 milligrams every 6 hours. Gabapentin 300 milligrams once a day, and then morphine 80 milligrams per day, and then baclofen 20 milligrams orally 3 times a day for 3 days.
Aiming for people affected by stroke. Changing a patient position in bed if it requires help keep blood flowing. This helps the skin stay healthy and prevents bed sores. Lying on affected side. 1 or 2 pillows for head. Make sure the positioning and placement of pillows can be used to achieve safe and comfortable posture. Place an affected leg forward on 1 or 2 pillows. Affected shoulder position comfortable. Place pillows in front and behind of the patient. Lying on unaffected side. 1 or 2 pillows for head. Affected shoulder forward with arms supported on pillow. Place affected leg backwards on 1 or 2 pillows. Place a pillow behind of the patient, lying on back. Place 3 pillows supporting both shoulder and head. Place affected arm on pillow. Sitting in bed. Sitting in bed is desirable for short periods only. Sitting upright while supported by pillows. Place both arms on pillows. Sitting up. Sitting will back in the center of the chair. Place arm well forward onto two pillows on table. Feet flat on floor. Knees directly above feet.
Bedside care for patient with spinal cord injury or SCI. Since there are some options for positioning, today we are going to tackle about the lying supine in bed. We are going to position the head of the bed as flat as the patient can tolerate. We are going to use only minimum amount of pillows under the patient's head to avoid any muscle tightening in the neck, which will affect the patient's breathing and swallowing. We are going to place pillows under the patient's arm to elevate them off the bed if patients have edema in his or her hands or arms. When we are going to elevate the head of the patient, we are going to make sure that the legs of the patient remain straight with knees flat. The changing of patient's position must be every 2 hours to eliminate increased pressure on bony areas, to reduce skin breakdown, and help reduce tightening of your muscles. And lastly, the nurse must closely monitor the patient's blood pressure.